In today's presentation, we'll be looking at the immune system. Our group members include Jade Mirage, Matana Matthews, Bernadine Machan, and myself. So our objectives for today includes the overview of the immune system, the key components of the immune system, immune responses, mechanisms of action, examples of disease and immune system dysfunctions, and recent advancement or immune therapy. This presentation how important immunity is within the body. There are a few main objectives that will be discussed today. These include overviewing the immune system, discussing its key components, recognizing immune responses, learning its mechanisms of actions, viewing diseases and dysfunction, and lastly, discovering recent advancements in immunology or immune therapy. Overview of the immune system. The immune system is the body's tool for preventing or limiting infection. Like all other body systems, it is a large network of organs with white blood cells, proteins, and chemicals. These parts function as a whole unit to protect the body against harmful pathogens. Important to note that the system does not always get it right. However, for instance, in some cases, it is unable to fight effectively because of the person inhibits functionality of the immune system. So what is immunity? The immune system becomes stronger when exposed to multiple pathogens, and we're able to develop more immunity. There are 3 types of immunity in humans: innate, adaptive, and passive. Today we'll be looking at innate and adaptive. Innate immunity versus acquired immunity. Innate immunity is the protection that you are born with. Your innate immunity sends the invaders right away by attacking any harmful organisms that shouldn't be in your body. Training is, however, necessary to tell the difference between cells that belong within your body and cells that do not. Additionally, white blood cells that are involved in innate immunity do not learn how to recognize specific invaders. They have zero memory of attacking invaders and cannot offer any protection from specific pathogens or possible infections that they might cause in the future. This is why acquired immunity is relevant. Or specific immunity is the protection that your body gains from exposure to pathogens over time. For example, lymphocytes are capable of remembering certain invaders, and they can tell if things belong in your body or do not belong in your body. So if an invader tries getting into your body again, the lymphocytes would start working with other cells to eliminate the invasive pathogen.
Our bodies are under attack daily. Pathogens hijack healthy cells, treating them as a hotbed to multiply and to grow further in our bodies. Thanks to our immune system, we're able to fend off these attacks all the time. There are 2 types of immune defense that protect us from these sneaky invaders. The innate system acts as the first responder to eliminate any invaders. The adaptive system requires some form of training, serving as a second line of defense against specific invaders. Now, let's take a look at some of the main forces in our body's defense unit. In the innate system, natural killer cells identify and eliminate infected and cancerous cells, whereas dendritic cells gobble up pathogens, break them into pieces, and send signals to the second line of defense to initiate a more precise and targeted response. Macrophage engulfs foreign bodies and repairs damaged tissues. In the adaptive system, cytotoxic T cells eliminate mutated or infected cells. Helper T cells give commands to B cells to secrete antibodies and inactivate or remove any threats. As our immunity declines with age, it affects their ability to fight against foreign invaders as well as cancerous cells. Store your immune cells today.
Key components of the immune system. The immune system consists of several essential components that collaborate to shield the body from diseases. These elements work in unison to identify, combat, and retain memory of germs, ensuring the body remains healthy. 1. Immune cells. White blood cells. The primary defenders, which include T cells, eliminates infected cells and assist other immune cells. B cells produce antibodies to target invaders. Macrophages consume and destroy pathogens. Neutrophils combat bacterial infections. 2. Organs. Bone marrow, responsible for producing blood cells, including those essential for immunity. Thymus, the site where T cells mature and learn their functions. Spleen, acts as a filter for blood and plays a role in combating infections. Lymph nodes serve as checkpoints where immune cells gather to confront pathogens. 3. Tissues. Lymphoid tissues located in areas such as the tonsils and intestines where immune cells are actively engaged. Mucosal membrane provide protection at entry points like the nose, mouth, and digestive tract. Immune responses. The immune response serves as the body's protective mechanism against harmful invaders such as pathogens and foreign substances. It comprises a sophisticated network of cells, tissues, and organs that collaborate to identify, attack, and eliminate threats. 1. Primary immune response. This occurs when your body first encounters a pathogen. Your immune system requires time to learn how to combat the pathogen. Developing a defense, such as antibodies, takes seconds off. Your body retains a memory of the pathogen, allowing for a quicker response in the future. 2. Secondary immune response. This occurs when the body comes in contact with the same pathogen for a second time. The immune system responds more swiftly due to the presence of memory cells that identify the pathogen. The infection is typically eradicated quickly, often resulting in no illnesses or only mild symptoms. In summary, while the primary response is slower and allows the body to learn, the secondary response is more rapid because the body recalls how to combat the pathogen.
So now we'll be looking at the mechanism of action. Primary immune response. Long-lived plasma cells called memory B cells are mostly produced in germinal centers. First, T cells activate naive B cells during the first immunological response. B cells then travel to secondary lymphoid organs such as the spleen and lymph nodes, where they enter germinal centers or B cell follicles in the cortex. So B cells then multiply and go through somatic hypermutation inside germinal centers, which alter the receptor's affinity. The affinity of the receptors within the germinal center is then assessed. In summary, T cells send survival signals to B cells that are able to bind their antigens on follicular dendritic cells, while B cells that are unable to bind or bind with low affinity are outcompeted and die through apoptosis. Additionally, B cells will transition from IgM to different kinds of antibodies.
So now we will speak about diseases and immune system dysfunctions. Example, autoimmune diseases, allergies, etc. So that protects against harmful invaders like bacteria, viruses, and pathogens. It identifies and destroys foreign substances while distinguishing them. An autoimmune disorder occurs when the immune system mistakenly attacks the body's own healthy tissues. And immunodeficiency disorders are conditions where the immune system is weakened or fails to function adequately, leaving the body vulnerable to infections and diseases. We can also note that each of these conditions affects the immune system differently, leading to either an overreactive response or weakened response to an inappropriate attack on the body. Here are some examples of diseases and immune system dysfunctions. Number 1, autoimmune diseases. This includes rheumatoid arthritis. This is the immune system mistakenly attacks joint tissues, causing inflammation, pain, and swelling. There's also lupus, which is systemic lupus. This is the immune system targets multiple organs, including the skin, joints, kidneys, and hearts. There's also multiple sclerosis. This is the immune system attacks the protective covering of the nerve fibers in the central nervous system. There's also type 1 diabetes. This is the immune system attacks insulin producing cells in the pancreas. And lastly, celiac disease. This is an autoimmune reaction to gluten that damages the small intestine. Number 2, we have immunodeficiency disorders. We have primary immunodeficiency disorders. This is genetic conditions where parts of the immune system are missing or not functioning properly. There's also a severe combined immunodeficiency known as SCID. This is known as the bubbly boy disease. It results in a severely weakened immune system. There's also common variable immunodeficiency. This leads to low levels of antibodies and frequent infections. There is also stuff like acquired immunodeficiency syndrome, such as HIV and AIDS. HIV attacks and depletes immune system cells, CD4 and T cells, leading to AIDS and a weakened immune system over time. For number 3, we have hypersensitivity reactions. We have allergic reactions. This is the immune system overreacts to harmless substances known as allergens, causing symptoms like itching, swelling, and respiratory issues. We also have asthma. This involves inflammation. Then there's also food allergies. This is the immune system reacts to specific foods, potentially leading to anaphylaxis. And anaphylaxis is a severe, life-threatening allergy reaction, low blood pressure, and shock. For number 4, we have chronic inflammatory disorders. We have inflammatory bowel disease, IBD, of the digestive tract, including Crohn's disease and ulcerative colitis. Then we also have psoriasis. This is an immune-mediated condition that causes rapid skin cell turnover, leading to scaly skin rashes. For number 5, we have cancer related to immune cancer of the lymphatic system, including Hodgkin's and non-Hodgkin's lymphoma. We have leukemia. This is cancer of the body's blood-forming tissues, including the immune cells and bone marrow. And lastly, we have myeloma. This is cancer of plasma cells, which are a type of white blood cells.
So what is CAR T cell therapy? So basically this is an immunotherapy where patients' T cells are genetically engineered to recognize and attack specific disease cells such as cancer. These modified cells are equipped with chimeric antigen receptors, and these are introduced in the body to help better target and destroy the abnormal cells effectively. CAR T-cell therapy is a groundbreaking immunotherapy approach developed for blood cancers like leukemia and lymphoma. As said previously, this is our T-cells modified to express chimeric antigen receptors, which further enables them to identify and destroy the cancer cells more effectively. Researchers are now exploring CAR T-cell therapy for solid tumors, using biomaterials like hydrogel and nanoparticles to improve T-cell delivery, infiltration, and reduce unwanted effects. These materials also introduce safer non-viral methods for gene delivery, making the therapy more cost-effective and accessible. CAR T-cell therapy can combine therapeutic and diagnostic capabilities, allowing precise tumor targeting and patient real-time monitoring. In 2022, Dr. George Sachet applied CAR T-cell therapy to 5 lupus patients, resulting in remission and no longer needing immunosuppressive drug. This therapy represents a transformative approach in medicine, offering hope for conditions once considered untreatable.
So, in conclusion, understanding the immune system is crucial for recognizing its role in protecting the body from harmful pathogens and maintaining overall health. Throughout this presentation, we've explored the key components of the immune system, examined its intricate mechanisms of action, and discussed the various immune system responses that help defend the body against diseases. We've also touched on the impact of the immune dysfunctions, including autoimmune diseases, immunodeficiencies, and allergies. Lastly, we've highlighted some of the exciting advancements in immunology and immune therapy, which continue to offer new insights and treatments for various conditions. The immune system complexity and its ongoing development in science emphasize its critical importance in our lives and in the future of healthcare.